in the essence of time, we will start this session. Thank you everyone for joining. Let me, first of all, wish you all a very good morning. Okay, it gives me great pleasure to introduce our distinguished speaker today, Dr. Sakshi Jain. Dr.
Thank you.
Jain is a highly accomplished nephrologist, having completed a MBBS and MD in medicine from GSVM Medical College, Kanpur, and her DM in nephrology from the prestigious SGP GIMS, Lucknow. With over 5 years of dedicated experience in nephrology, she currently leads dialysis services at Ajanta Hospital's NephroPlus unit in Lucknow, where she sees more than 1,500 dialysis sessions each month. Dr. Jain has also made notable academic contributions, including award-winning presentations at national conferences and published research in the field of renal transplantation. Her interests include acute kidney injury, transplant care, and ICU nephrology. We are honored to have her with us today. Please join me in welcoming Dr. Sakshi Jain.
Thank you, Krunal, for the introduction. Am I audible, Krunal?
Yes, ma'am. Yes, you are audible. Great.
Welcome all the attendees for sparing some time on a Sunday morning for listening to the talk on mental health in dialysis patients. We can start it with Krunal with the questions.
Sure. So I'll just give you, everyone who has joined, I'll just give you a quick introduction of the topic that we are going to cover today. As you can see on our screen, it's basically a calmer mind, a healthier you. Okay, mental well-being for dialysis patients. Now, mental well-being is just not, we see that after COVID, there's a lot of awareness towards the mental well-being and there's a lot of attention being paid towards improving well-being. But in this day and age where we have a lot of social media distractions, our diets are good, our work-life stress has increased, and there are so many other things in the environment that's causing harm to us. Mental well-being is extremely important, in some cases more important than the physical health. But in today's webinar, we'll cover mental well-being for dialysis patients specifically. And with this quick introduction, I would like to start by asking Dr. Sakshi a few of the things that we've been collated across. These questions more or less comes from our guest in our interaction with our guest. By the way, if any of you is not familiar with NephroPlus and have not joined before any of our sessions, you should know that we specifically call dialysis patients as dialysis guests. We believe that they can completely live a normal life and they just come, do their dialysis and go. So they cannot be considered a patient, but rather a guest. And that's where our whole guest care attitude comes in, right? So this brings me to the first question, ma'am. What do you think is the most common emotional challenge a dialysis patient faces?
Especially if we see all these dialysis patients, the patients who are suffering from kidney disease, if we see their journey is not only for the dialysis. Few of these patients, means you can say around 50 to 60% of these patients were diagnosed as CKD before initiation of dialysis. Only few of these patients are diagnosed directly into end-stage renal disease. Few of the patients are diagnosed when their creatinine levels were around 2 or 3 or nearly 4, and then gradually they progress towards ESRD and requiring dialysis. So it's a very emotional journey for them and their families also, especially the children and the spouse and the parents if the patients are on the younger side. So it's a very emotional and sometimes emotionally painful also seeing their patient gradually converting from CKD to dialysis journey. Especially these patients suffer from the problem of anxiety, which is very common in these individuals. And gradually we have seen patients suffering from depression also. Sometimes these patients have both component of anxiety and depression. And we have seen patients with bipolar and other cognitive disorder. But I think the most common disorder we have seen emotionally these patients suffering from is anxiety and depression.
Got it.
Which is not only seen in the patients, and it is also seen among the attendants also.
Absolutely, and that will be one of my questions for today. But I'll just touch upon this aspect that you mentioned that majority of them have an anxiety issue.
Yeah,
what do you think it stems from? Is it a lack of information? It is the scare generally that is around dialysis?
I think
What is your sense of it?
basically the patient have anxiety. I think one component is obvious, as you said, that there is a lack of knowledge. There is also a lack of surety of their future. The main concerning point for the patient and the attendants is the lack of concern for the future. They don't know what is going to happen in the future, whether they are going to live for 1 day or 1 month or 1 year. That is the main thing. The longevity they have thought when they were completely normal versus the longevity now which is present, seeing other individuals in the dialysis. This leads to their tension and leading to various emotional disorders such as anxiety and depression. Sometimes we there are very subtle symptoms. Sometimes the patient doesn't say some many things, and there are very subtle symptoms at home. We can see the patient is sitting quietly, not talking much to anyone in the family. There is no aptness in doing any activity. Like earlier, the patient used to, if a female is there, she used to cook the things and do various household chores. But now the interest in doing all these things and doing means cooking for their favorite food or their family favorite food is reduced when their diagnosis is diagnosed. The diagnosis of CKD or dialysis is made. There is the patient get angry on very very small things. Even if we ask them a question twice, the patient sometimes get angry that why are you asking me again and again. And if we ask them a bit in a louder voice, thinking that the person is not able to hear, they say they readily aptly reply that we are not deaf and dumb. We only have a kidney disorder. We are not otherwise challenged. So these are the basic small symptoms which we or the attendant can see at the home, that the patient is landing into some emotional component and requiring any emotional support, which should be seen. I can list down all these emotional symptoms which can the attendants or the patient themselves can look upon as they could be low mood. The patient can be sad over a long period of time over a small thing. Patient can be angry over small things. He would be worrying over small petty issues. Feeling the patient usually have a complaint of having that they are burden on their family or their caregivers, that they are a financial burden and emotional burden and physical burden. All three four burdens are there. If we see physical, emotional, mentally, and financial burden, they think that they are very dependent on these their attendants, and their life is completely changed after diagnosis of CKD or ESRD patient. CKD patients still have a very way better life than the ESRD patients. That's why the patient think along the gradual transition that their life is going toward a worse side. But I think this is only a thought and a perception of mind which a patient and their caregivers can change over a gradual period of time.
Got it, ma'am. I think you touched upon multiple aspects that A, their patience level will go down. B, it also takes a toll on their family. So we'll touch upon this aspect. But I want to quickly check. You spoke about mood, so I want to just quickly check that people on this call. Let's see how they are doing today. So Amia, if you could just put a quick poll here, I think that would be very helpful, and
Yeah,
we'll
of
just
course.
continue.
It would be
Yeah.
very good if the attendees have some question or they have some ideas also to
Yeah.
battle this emotional challenge in these individuals.
Absolutely. So, everyone who has joined, please, we have a very active chat box. Put in your questions. आप अपने questions वहाँ पे रखिए और ये questions हम ये session के end में पूछेंगे. We will ask these questions towards the end of the webinar, and we'll try to cover maximum all the questions that are there. Okay. We also have a Facebook Live, by the way. In the chat box, you can see there's a link which will route you to Facebook. And this entire webinar will be recorded. We'll be sharing this video on our YouTube channel. So please subscribe to it, and you can take the entire. You can watch the entire session there as well. So quickly coming back, ma'am, I have observed, in my day-to-day operations that CKD is not only, and people on dialysis are not only from a certain age. Now, it's also prevalent in younger
Older
generation, older generation.
geriatric population.
Absolutely. Do you think the mental well-being or the mental state of the person differs as per the age, or rather even the gender for that matter?
Yeah, of course. The mental well-being vary according to their age and their gender. Especially if the child is going, a school-going child is undergoing dialysis, he would be worrying that he would be having a phobia of a body image. which is less seen in the older individual, that if he would be having any jugular catheter or any permacath catheter, or what say even a fistula is there, even if they are very worrying that if another child or another student in the school will see it, what would they would be asking and what answer he would be giving to them. So sometimes we suggest them some options also, that if you have a jugular catheter, you should say that this is a type of antenna, and he would be getting more knowledge, and he would be scoring very
Wow.
good marks in the exam,
Very
and he has a
interesting.
direct connection with the, someone in the boardroom, so he would be getting more marks. So other students also get excited to see what is there, and he become the main focus in the class, that he's having something very good in his body, which is making him some special thing. So and about the fistula, we say that beta, you say that इसमें current आता है, and I am like a electric man, and if you touch me here and there, I will throw a current on you. And for that, the patient, usually these kids are when they many to usually skip their schools, but the students who the child who are going to their schools are there very, very happy. Sometimes they come back and tell also that आज हमने ऐसे बोला तो हम लोगों को बच्चों ने छेड़ा नहीं, या they didn't tease us because of our fistula or any cats or any access issues. So and this body image is also seen, that usually we have seen in dialysis patient that there is skin discoloration in the patient. Usually patient get darker on a when they are on a regular dialysis because of the you can say the oxidants because of the dialysis or because of the various iron injections. The patient usually get a darker skin. We usually suggest all these individuals some of the home remedies so that they can get a they can prevent this discoloration and this body image changes, and we suggest various ideas to these individuals that they can do various things to improve their body image and their concern for their body image. That I can give you one example. Once
Sure.
there was a rainfall going on in the area, and one of our dialysis patient fell down in the rain. And 2-3 people came to pick him up, and they just hold their and this fistula hand. And there was a thrill in this fistula hand, and they said, "Ki isme to current aa raha hai, current aa raha hai." And, he left, and people left him there only in the rain. That you have a current in your arm, and we'll get that current. So he said, "No, no, there is no current, and I have this fistula is there. You hold my another hand and pick me up. Otherwise, I would be lying down only." So these are various things which the patient face because of their body image. But overall, I can say that these individuals are very strong well-wise. The patient who are undergoing dialysis, they are very strong according well-wise. A patient who is diagnosed CKD and gradually going to choosing a dialysis as an option for his renal replacement therapy, they are very strong-willed, because it takes a strong will in these individuals, these patients, to undergo a procedure, a dialysis. Usually, there is very less acceptance still in our society for these individuals and these procedures. So, still the patients are choosing this method for their families and for their themselves and for their survival. It's very good and very strong will, and that should be, I think, motivated by the family and the center people also, so that they gradually undergo dialysis and they don't feel low that they are undergoing dialysis and this is like end of life. They should not think like that. We have seen so many patients are there in dialysis unit who are undergoing dialysis for 5 years, 10 years. Some people are undergoing dialysis for 15 years also. So we should not think dialysis as the end of life care. This is the end of the life and there is no life after this. I've seen my patients who say that we are having golgappas whenever घर में कुछ भी बनता है हम खाते हैं, थोड़ा क्वांटिटी में खाएं लेकिन खाते जरूर हैं, चाहे वो कुछ भी बने. So these patients should undergo self-care and self-improving behavior, that they should take care of themselves, their diet. They should have a good diet, good appearance, good look, good clothes. They should wear good clothes, so they would be feeling good and acceptable in the society. This is one of the thing, body image changes. I still sometimes females who start undergoing dialysis, they come in maxi or nighty dress, that we are having jugular and we are relaxing at home, so we will come in the same dress. So I usually tell them, you are so good, you are so good looking, why are you doing like this? You should come in a suit or in a sari, whatever you used to wear, you should come in that attire only. And this is not acceptable to me, I say. And then the patient usually think upon this, and they usually I've seen this change, and they usually then come in salwar suit or sari, whatever is preferable to them, and they also feel good about this.
Understood. So that's a very interesting take, ma'am. I think again you touched upon a few things, that willpower and at the same time, I would say discipline is extremely important. Ma'am, do you see this willpower? You mentioned certain things like keeping up with yourself and trying to normalize your lifestyle. You know, uh, anything that particularly you suggest apart from the things that you mentioned to older people as well? We see that in the older people, usually, their willpower may just be a little
Yeah,
not
on
so
a
great
lower
as compared, yeah, as compared to the younger ones.
younger
So,
age.
anything that you suggest to your
I think
guests?
the older individuals can have a self-care group, or their friends should be there. They should have a small group, 2, 3 people or more people. They should not leave their parties or their kitty parties or their satsangs. I always tell them you should go every evening. You go down or you come out of your house and go into the park. Even if no one is talking to you, just sit near them,
Yeah,
and gradually you start talking to them, and gradually you will involve in their society or in their group, and you will yourself will feel very good upon these things, that you are getting intermingled into the society. I usually ask the females, you should change your clothes in the evening, wear some bangles, apply some makeup, and then go to mandir. You daily go to mandir. Some people are not going out of the home for months. They have not left their home except for the dialysis. They have not left their home for months. So I always
true.
tell them, you go to any place, you go to any worship place, not only mandir. Every religion has their own places. So you go out and have some go to mandir or church or mosque, anywhere you want to go, but you go out of your home just for one thing, morning, evening. But you have to leave your house and at least go out and have your group, even if you have your old friends or old kitty parties or any groups. You have your office friend. For males, we can say you can have your office friends. You can go there, have a chat. You can talk about yourself, even if you want to cry. I always say, if you are feeling very low and if you want to talk to anyone, talk. Yeah, there is no harm. You talk to any cat, dog, human, anyone. You just
Hmm.
talk to them, feel lighter, and if you want to cry, you cry it. You fully cry it. You cry for half an hour, 1 hour, and then you get relaxed. You should have your if you have any panic attack, any breakdown, emotional breakdown, you should let it go. You should drain it off. You should not hold it for a longer time. If you will hold it for a longer time, you will only will be under pressure.
Got it, ma'am. We see that in the Western countries and some of the developed countries, the support group function is very active, and it helps a
It's
lot.
not
Whether
only in the Western countries. In India also, we have very support groups. If you see, if you ask all these patients, they all have their WhatsApp groups of dialysis.
correct,
All these
correct.
dialysis patients are in their WhatsApp group, and if anyone is having any problem, they usually some people, patients tell them that they put in the group, and if they are having any financial constraints also, the other dialysis patients are helping them out to get the treatment done, or getting the better option where you can get a good fistula done, where you can get a good access done. If you want to get fistula angioplasty done, and the patient is not having money, the dialysis patient or the support group are helping them to get these procedures done. Even they are helping in small amount of money, but people do help with a 500,000 rupees also. They are helping out. And if for the
Absolutely.
young patients, I have seen that I usually ask them what you used to do earlier before getting the diagnosis of CKD. One question is not in the first visit. When the patient gets settled on dialysis after 3, 4 dialysis, I usually ask them what you used to do earlier.
Hmm.
And then the patient used to say, we used to work in a MNC, or we used to work on a computer or something like that. Even so, I asked them, you take a part-time job and you do whenever you want to do. Take a part-time job and you do a computer job from your home. That is really very easy. One of my patient is because of dialysis and long-term dialysis, he's nearly around 10 years on dialysis. He got some bone issues and he is presently wheelchair bound, but still he works. If you see him, you can't say that he dresses well, he comes very in a good dressing, and he works from home, and he is financially very strong, and he is now starting to invest his money in share market and this mutual funds also,
Wow.
and he's doing really very well. So we have to promote all these patients that whatever they were doing earlier, they can do that job in a part time, not in a full time.
Got
If
it.
they are not able to do in a full time job, they can do it in a part-time job. If a farmer is there, he's now won't be able to do farming because he would be feeling very weak after dialysis or incorrect. I usually ask them, you open a small kirane ki dukaan or a small kirane ki dukaan, or you open a pan ki dukaan. Whatever you do something at your home. It would give you some livelihood for your family also. Even if female is there, I ask them, you make something whatever you like to eat. आपको
Got
जो
it.
पसंद है खाने में आप वो बना के खाइए, लेकिन खाइए हफ्ते में 1 या 2 दिन आप अपने मन का पसंद का खाना खाएंगे, कम क्वांटिटी में खाइए ताकि आपके इलेक्ट्रोलाइट डिसऑर्डर और वो सब दिक्कतें ना हो. But I always ask them, you eat in a small quantity, but you can eat everything. Even if you want to go in a shadi or a party or a wedding, you should go and you should not avoid that. That is a thing.
Got it.
We should promote them, and the family also should promote them going into all these function and including them into the mainstream and the family and relatives. And they should talk openly to the relatives that we have got a illness. Yeah, our relative has got an illness, or and they should prepare the relatives also that this can happen with anyone. This can happen with. Means I have seen so many doctors
Yes.
undergoing renal transplantation and dialysis. So this can happen with anyone. There is no exception. No one knows who would be harboring a renal disorder. So this is not their fault. One should make them understand, the attendants and the patient should also understand this thing, that it is not their fault that they have got a chronic illness, chronic kidney disease or any chronic illness. It's not their fault. Sometimes you have your मतलब नसीब कहते हैं या किस्मत कहते हैं, वो खराब थी तो इसीलिए हो गया, otherwise the thing happened.
Absolutely. So I think the essence is that you normalize it and live it as normal as possible, because that is the whole thing. Dialysis is it's just a journey. I mean, you can live completely normal, and like you said, you can you may not be able to do exactly what you were doing before, but you can still be able to do closely as much as possible. And I have seen, ma'am, personally, a lot of people who are actually working. They have office job, so they come early in the morning, they do their dialysis, and then they dress. I mean, in the same formal attire, they go to office as well, and they will living extremely normal life.
Yeah.
Yeah, and I think even their colleagues probably may not know that they are currently on
Undergoing
dialysis.
dialysis. Yeah, of course.
Yeah, absolutely. So
And I
great.
think they
So
should tell their colleagues, a small hint should be always there, that means through their help or through their talks, they should tell them a bit that there are people who are suffering from chronic illnesses. And it's very normal that people would be having, if you know the epidemiology of CKD, not only for the dialysis, but CKD is prevalent in around 10% of our population, of Indian population. If we have 140 crores, imagine 14 crore of the individuals having some amount of renal dysfunction. They are not on dialysis, but the prevalence is CKD. Whether they would be creatinine of 1 or 10, that is a difference. But there's a prevalence of around 10% in our population of CKD, especially in South India because of the hot climate, and in this Andhra belt, there's a diagnosis of CKD-U that is of unknown origin because of extreme weather conditions or because of the various harmful minerals in the water. I think this is a very common illness nowadays. If you we are seeing as the epidemiology is increasing of every chronic illnesses. So small hints should be given to the colleagues whom you don't want to tell because of your job profile or your something. But small hints should be given intermediate, that if whenever you fall ill, there should be some help from the colleagues. So small
absolutely.
be there.
Absolutely. Again, it's part of the normalization of their journey. So nothing to hide about, obviously.
Nothing to hide about. Yes.
Yeah. So, ma'am, we touched upon this aspect about attendants, caregivers, the family. What do you think? Like, we understand, and I have seen that there is always one constant attendant who comes always. I've seen also children, I mean, people our age who comes along with their parents, and on their laptop, they in the waiting area, they actually working as well. So, what do you think is the emotional well-being, or rather, the emotional state of an attendant or a family member for somebody who has a family member going undergoing dialysis?
The emotional status would be, I think, 80% of the patient If the patient is
Okay.
suffering 100%, the attendant would usually suffer 80% of that emotional burden, and they sometimes also go into the depressive phase. We also have to talk to them that if you are not happy, or you are not satisfied, or if you are not cheering him up, or you are not cheerful yourself, then how can the patient would be cheerful? If you are only sad, then he will see you sad, and there would be a cycle of sadness going on with family. So we always tell them, take a weekend, or once in a month you go out for a dinner among yourself, among the patients, and you take the patient out. It would be good for the patient also, and for the attendants also. I usually advise them, as you are undergoing dialysis in NephroPlus, you will get the NephroPlus dialysis anywhere in the country. You can
Absolutely.
go for vacations also. Once in a year or twice in a year, I say you go to a pilgrimage. Don't go for a vacation. Sometimes people say, "अरे हम तो बीमार हैं, हम कैसे घूमने जा सकते हैं?" So I say, you don't go to any घूमने वाली जगह. You go to मंदिर, or you go to some any dargah, or anywhere you want to go. You go to that place and you go for a worship, that your health get improved. So people usually
Got it.
start going, and they usually feel very better. Attendants also feel very better, with a, especially if they elderly female is, or a male is undergoing dialysis. I ask them, you go home and you play with your grandchild or a granddaughter or grandson. And usually they say ki whenever we go back after 4 hours of dialysis, our grandchildren usually come running to us, and we forget all our pain, and we start enjoying with them.
Wow.
So that is a very good thing for the family. If family support is there, you can win any battle, I think.
Absolutely, ma'am. I think you've touched upon a few things that just spending more time with family itself can also release some amount of stress. You know, so ma'am, we'll just come to a few of the practices that you suggest. I think you mentioned a lot of things. First is around dressing up, in a way that is normal, and you don't need to particularly, coming as a patient, rather, go
Right.
out every day, have a sense of well-being. You can either pray or go out, do any physical activity. If we were to, list down a few things, like if somebody were to come to know about that they will be put on dialysis, is there anything that you would suggest them to do, like immediately to begin their journey, so that the emotional turmoil does not hit a certain level and then it fizzles out? Like how does a person immediately who goes on dialysis have this emotional
I
well-being?
usually connect them with the other dialysis patients,
Okay, got it.
other dialysis patient attendants, how their journey started. Usually, if we explain to them, they sometimes feel that a doctor is explaining. He's just, his work is there to explain and keep us on dialysis and all these things. Sometimes patients feel like that. So I ask them, you talk to your subordinate or the bed nearby you. There is a bed on your right side and there is a bed on your left side. Whichever you feel like, you start talking to them according to
Hmm.
your age, according to everything. They start talking to them, and the patient, I think, feel way better talking to their subordinates, like or the other dialysis patients, as compared to us. Sometimes they ask their problems also to them, and sometimes they take the solution from them rather from a doctor. And I think that is a very good part also, because
Sure.
they themselves have a very good support group. In our center, sometimes the patient is not coming for a dialysis, and I'm just talking to my lead tech or a senior technician that why this patient is not coming. You have asked them or not? If the any attendant or any other patient hears our talk and he says, no 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 ma'am, that वो तो वहां गया हुआ है घूमने, अभी आएगा, उसके घर में शादी है, वो अभी आएगा, उसकी कल शादी थी, हम लोग सब वहां पे गए थे और अब वो आएगा. So I've seen, not only among the patients there is a coordination, it's among the DMOs and the lead technicians also, and the technicians also. I've seen them going into the patients का जो ऐसा बच्चे का marriage है या बच्चे का कोई function है या उनका कोई function है, they usually, I've seen our lead techs and DMOs, means according to the friendly behavior, patients also call them, and we also sometimes try to have a celebrations. Every festival celebration is there and everything is there, so that the patient think they are part of a normal life and a normal community and a society. So it's really very good over there, I think.
Absolutely, ma'am. So we also I keep hearing from few patients when I go, the few guests from when I go to the center, they say that this NephroPlus staff is like my second family. At times I might get a little irritated on them, but they know that deep down there that they will be taking care of me. And
Plus,
then
I
the
think whenever patient is having any problem at any time of the day, whether it would be 3 in the night or 12 in the morning, I think we are always there. And NephroPlus, it is a repo, and all the technicians are so much trained and so much concerned about our guests and the patients that they, even if they are themselves admitted in the hospital, they would pick a call of their guest and talk to them and get a solution for them to be done, so that the patient doesn't have to suffer, or if the patient is having any problem, it would be sorted out in the night or the day or any time of, I think, of the whole day. We are
absolutely.
always there for the patients, for our guests.
Absolutely, ma'am. Again, that's part of our NephroPlus value that guest care comes first. So it resonates in all our operations. Ma'am, one question that's been, on my mind, that we spoke about attendance, we spoke about dialysis patients, but for people who have not come across anybody in their family who's on dialysis, if they come to know, what do you think should be, their approach, or because there's so much of lack of information. I would not say misinformation, but lack of information or lack of interest in dialysis. So if anybody who's not aware of dialysis, how should they approach, if any of our viewers would watch it, they would probably want to know this.
Think there are various YouTube support groups or YouTube channels, various apps through which the patient can communicate among themselves and get the knowledge of dialysis. Even if they are not able to understand it scientifically, they can approach their doctors again and again that we are not able to understand. I think we also, as a part of doctor, should ask them again and again whether you have any question or whether you have any doubt. You should ask me freely and frankly about the start of the dialysis. What is dialysis? Doctor also should explain that there is a filter and blood would move out of your body, will go into the filter and it will return back into your body, and it would be a very normal process. We have to explain them again and again from our point of thing. And secondly, we can associate them with various YouTube channels. Like NephroPlus is also having one YouTube channel which encourages people, or and basically make the people understand what is dialysis and what are the alternatives for dialysis, whatever the things are associated with renal disease. All the things are there available on our NephroPlus channel on YouTube. So there the patient can get information, or it can be deciphered from a doctor or a dialysis technician, or basically from a counselors. There are various psychologists, or you can say counselors, dialysis counselors, like we have in our transplant teams. We usually have a transplant coordinators or a transplant counselors, but
Okay,
these transplant counselors also work very good for the dialysis patients. Sometimes we
nice.
use them. Sometimes patient doesn't want to agree for a doctor. Nowadays image of doctor is very not very good in our country, but still we can take the help of our various counselors. Like we have a transplant coordinators and counselors, they usually help these patients to undergo dialysis, initiation of dialysis. Sometimes these people also very help in these things. I think if the still the patient is not able to understand, or if the patient is having the manifestation of any illness, cognitive illness is there, or the patient is having severe panic attacks or any anxiety, or in spite of all these conservative managements like self-help group or any YouTube channel listening to spiritual things, and everything is not helping out, then one should approach his nephrologist for all these symptoms, or any psychiatrist for these symptoms. And medicines can be initiated in low dose according to their renal function, so that they do not face any side effect of these medicines and also have a good effect, and they usually do better in all these things.
Understood, ma'am. So I think, if I were to just list down these pointers, it would one be
Yeah.
that don't just believe in people who randomly say various things. Actually, go and see an expert, a consultant, who would be qualified to give you an advice. And the second most important thing that you mentioned is that be vocal about what you're feeling. Hiding your feelings itself would probably result in more damage than
Yes.
recovery or improvement. So I think that's being vocal, being communicative to whoever you trust. It could be possibly a friend, a family member, or your doctor, or your doctor. Great, ma'am. So, you know, is there any app or any kind of, you mentioned YouTube channels and NephroPlus. Obviously, we try to put out as much information as possible to clear the myths and to be informative as informative as possible. And we bring doctors from various parts of India and outside as well. So anything that you particularly may follow for your
Uh,
uh,
we have
men-
various YouTube these apps such as or the YouTube channels such as this Brahmakumari app or Yogi, this Sadguru app, Isha Foundation. They usually help you. Isha Foundation, BK Shivani or Brahmakumari's app. There is a Mindful Talk app, The Art of Living. I have seen not only the dialysis patient but also CKD patient using all these YouTube channels and apps like Think Right Me, Arogya Setu, Inner R, and Your Dost app. Usually, these apps and YouTube channels have found to be very useful. And these patients, some of the patients, not they, there is no 100% in everything. Some of the patients have found it really very useful using these apps. That they are some patients are very introvert, some patients are extrovert, some patients are introvert. I think these channels would be helpful to the introvert patient who don't talk very much to the other patients
yes.
or their families. I think these type of individuals can use these apps and the YouTube channels. They can hear this during the time of dialysis. This can give calmness to their mind and their body, and their health would be better if, I think, if they are not able to talk to anyone, so they can use these apps and understand the meaning of life or the सार of life. कहते हैं जिसे कि जिंदगी का सार क्या है, वो समझ आ जाए तो आप इंसान से भगवान बन जाएंगे, वैसे वाली चीज है.
Very
तो
nice.
at least you can improve your life or the quality of your life using these apps, the way you think and the thoughtfulness of your life about it.
Very interesting. And I think whichever YouTube channels you mentioned and the apps you mentioned, I'll also tell you that these are free, by the way. So you don't necessarily need to pay. You can just go download it. And most of us have a smartphone and an active internet connection. So that while they are on their dialysis, this could be actively done. Awesome. So, Amia, we are actually, in the segment where we would like to take any questions that has come across, anything that you would like to mention on the Facebook Live.
Hi, Krunal. Nothing else as in V Live as well.
Okay, awesome. I think we've been quite articulate, and Dr. Sakshi has mentioned things in pretty clear terms and precise terms
Kunal, you
that
can
we've got.
say a few points. You are also in this renal industry for a very long time, so you can
Hmm,
add upon your point of view according to a non-medico into this field. You also have seen so many patients. You daily see
sure.
up
Yeah.
and downs of these patients. So I think you can also add a few points.
Yeah, absolutely, ma'am. Thank you. So first thing, I think we should all, I mean, my strong suggestion would be to have a routine, to have a proper schedule and follow it. So having a discipline towards maintaining a routine and following it is extremely important. Doing any kind of meditation, it could be just sitting, it could be probably just listening to soothing music, not necessarily any devotional sort, but just anything that gives you soothing and keeping your mind unoccupied for that time would also help, in a lot of ways. Third thing I feel is that speaking out. So, you can speak to your friends, be engaged with them. Definitely, if you meet them, people get busy in their lives. But if you talk to them, if you discuss, there will be a lot of exchange of ideas, talks, and I'm certainly, I'm sure that there will be a lot of good things that comes out of it. And the fourth important point is that go out for a movie, go out for a walk with your loved ones, just try to be as normal as possible. And we have our founder, Kamal Shah, who's been maintaining amazing discipline, and he swims every day. He's actually physically more active than me, maybe. And he does a great job. He's always there at the office as well. So dialysis is just a means to live your end. Okay, there is a slight modifications that you would do, but you can definitely live an extremely normal life, which we have seen across, and normalize your life. I think a lot of good things are there out the world. We can just see and pay attention to that, and definitely we can distract ourselves with that. So yes, ma'am, that would be my point of view on it.
Yeah, that's a really very good point. Krunal, that one should be taking care of self. I think the crux of our talk today would be, I think I can summarize in 3 points. That would be, we should build a support system, whether it is a family, friend, or anyone is there, and we should seek professional help whenever needed, and we should engage in self-care. Self-care can be both mentally and physically. It should be both. Not only physically we are taking care of ourselves and mentally we are deteriorating. We have to take care. These individuals have to take care, go into self-care both mentally and physically. That is one.
Awesome.
3 crux points: seek professional help, engage in self-care, and build a support system.
So that very well summarizes, ma'am, our entire conversation that we've been having since the last 45 minutes. I'll just take a quick moment and ask again if there's anyone who has any question before we conclude this webinar. We would love to take it, or you can put it across later when we put it on YouTube, and we would answer there as well. So we'll just quickly wait for 10 seconds if there's anybody who would like to put anything. Okay, seems like again it was nobody has any questions and it was pretty articulate, ma'am. So with this we come to an end, ma'am, to our conversation. It was a very I would say enriching, informative, and a conversation that we've all been longing to discuss. And coming it from your side, an expert, and who's been meeting patients day in day out regularly, and who's also been counseling, so many beautiful things you mentioned on how you are actually helping people with their mental well-being. It's very very inspiring, ma'am. Very interesting. I hope you also enjoyed this conversation that you had
Of
with us.
course, helping these
And
patients is our primary goal.
absolutely. And I hope you enjoyed this webinar as well. So yes, ma'am, thank you so much for joining. We understand you're busy, and thank you for joining on a Sunday morning.
I think we
Wish you
should
a very
thank our attendees who have taken out time
absolutely, absolutely.
and
So that
joined the session. Thank you everyone
absolutely.
for joining the session today. I think
Thank you.
let's wrap up this session now. As there are no
Yes,
questions, we will wrap up this session. Okay.
yes. Thank you everyone for joining.